The patient usually recovers immediately. In fact, there is no general anesthesia, and quite often the same evening the patient can sit up in bed, and patient usually walks either the same evening or the next morning, and in a couple of days the patient usually goes home and resumes normal life. Usually, apart from taking a few medications and coming for regular follow-up checkup, there is no major do's and don'ts with respect to the patient once he has had a transcatheter valve surgery. So it's truly a minimally invasive or a non-surgical method of replacing the aortic valve, and the recovery of the patients is dramatic because most of the symptoms are immediately eliminated and patient feels better the very same day of the surgery.